Good morning, everybody. I've been looking forward to this for weeks. I don't know about you, but welcome very much to our discussion on the vexed question of social care. Very topical and hot this week, in particular with the manifestos coming out. Welcome not just to you. You're a very expert audience. I can hear a terrible echo. What is that? To you, you're a very expert audience, I can hear, but also welcome to the 250 or so people who are listening in on Livestream. Before I go any further, can we remove that echo, which is a bit off-putting? Do you want me to start again? Is that any better? Oh, yes, that's a lot better. Do I need to repeat? No. No, life is short. Let's continue. Okay. Vexed because, as you know, for the last 22 years have been littered with attempts to do this or that on social care. I lost count, but luckily my Nuffield Trust colleagues had counted what had happened. So in the last 22 years, 12 white or green papers or major government consultations, 4 independent reviews or commissions, including the one Andrew Dilnot chaired, published in 2011, 5 select committee inquiries, 2 all-party parliamentary group special focus groups on social care, a green paper from the Local Government Association, and of course the current government green paper, not delayed 5 times since announced in March 2007, and no timetable for when it will come out. What is going wrong? Why the block? And given the current spending spree that seems to be, all the squillions sloshing around with the election pledges, how come social care isn't number 1 in the list? It's not as if there hasn't been any government action. There has been some, hasn't there? Some options have been laid out. We've got the 2014 Care Act. Gordon Brown also came close in 2009, where a commitment to free personal care at home received royal assent in the bill, but was overtaken by the election, so wasn't implemented. And clearly, in the middle of an election, as you hear, we've had various promises already. Labour, free personal care and a cap. Lib Dem, cross-party commission and a cap. And Conservatives, we don't like people. People shouldn't have to sell their homes to pay for care. And this morning's announcement that there will be a cross-party consensus to try to seek a way forward. But really, how much weight do we put on any of this? And in any case, is a general election the time and place to announce anything where whatever you announce might get trashed in any case? And is a cross-party consensus, even though it sounds hollow, actually the sensible thing to do? So with that sort of preamble, what we're going to do this morning is to explore 2 things, I think. One is the nature of the problem and the options on the table, some of the likely solutions. And then I think the second thing is, well, how do we get here from there, given there's been such a political sort of impasse? And I don't know about you, but I can't think of 3 better experts, really. We've really got creme de la creme this morning. We've got 3 experts. We're going to start off with Anita Charlesworth. Many of you know Anita. She's our Director of Research and Economics at the Health Foundation. And before joining the Health Foundation in 2014, Anita was Chief Economist at the Nuffield Trust, and prior to that had a long distinguished history in government, where she was almost 10 years as Director of Public Spending at the Treasury, where she led the Wonders work, for example. Anita's going to speak for 10 minutes, and then we're going to go straight into the next speaker, who's Sir Andrew Dilnot, known to many of you, currently Warden of Nuffield College, Oxford, and Chair of the Geospatial Commission. But Andrew has a long, distinguished history. Also, he was Chairman of the UK Statistics Authority, for example, and was the Chairman of the Commission, as described, on the funding of care and support for older people, which reported in 2011. And among many other things, he was Paul Johnson, who's the next speaker's predecessor as Director of the Institute for Fiscal Studies from 1991 to 2002. He's also very well known presenter on the BBC Radio 4, where he does a lot of things involving numbers and crack analysis. And then Andrew will be followed by Paul Johnson, who is currently the Director of the Institute for Fiscal Studies. Paul also has a long distinguished history, but he's also been the Chief Economist at the Department of Education and Director of Public Spending, like Anita at the Treasury in his past, and as well as being deputy head of the UK Government Economic Service in his past. He has a regular Times column and is also very well known to many of you by many appearances on the Today programme and many other broadcast media, usually speaking 100%, well, always speaking 100% pure sense. So very pleased to have really a crack. So each speaking for 10 minutes, one after the other, then we'll have time for a really good discussion. And just to remind you, please tweet. The hashtag is hashtag social care reform. That's no spaces between social care reform. And also to say, as you know, the event is being live streamed and media are in the room. So we're clearly not following Chatham House rules. So with that, I think that's all. And over to Anita.
Morning, everybody. So the title of today is What Will It Take to Fix Social Care? And I'm going to talk a bit then about how we would define, essentially, social care being fixed. And I think the starting point for that should very much be the centrality in the Care Act of 2014, of a focus on well-being. And the paragraph 1.1 of the Care Act says the core purpose of adult social care and support is to help people to achieve the outcomes that matter to them in their lives. And in all the debate about people selling their homes and how we balance the responsibility of the individual and the state for care, what we need to remember is that it's really important, alongside that debate, that we focus very clearly on whether the social care system is delivering access and quality of care which enables them to fulfil that objective, to live meaningful lives. Adult social care is what we're talking about here, and adult social care obviously covers both older people, which people tend to think of, who need help with activities of daily living, so washing, dressing, eating, getting out and about, but also really importantly covers people of working age who also need help to live independent and fulfilling lives. And the first thing just to focus on then is what has actually happened to spending then on adult social care since 2010. And as you can see with the red line, this is overall spending indexed to the level in 2010, and that fell to 2014-15 and then has picked up a bit, is almost back to where we were, but still slightly below. But in a way, what's actually much more important is to think of what's happened to spending per person. And then given that so much of social care is supporting older people, when we adjust for the fact that not only has the population grown over the last 8 years, but it's also aged in that period, what has happened to age-adjusted spending? And as you can see, if we look at age-adjusted spending, whilst in one sense, there has been a tick up, really since then it's been pretty flat and just kept pace with that aging. So we are still on an age-adjusted basis, spending 12% less per head in 18-19 than we were in 2020-21. So we're trying to deliver high-quality outcomes for people. This doesn't obviously take account of complexity of need, which may also have got greater. Better quality outcomes for people on a reduced spend per head once you age adjust. And that's against a backdrop where in 2010, which is obviously what I've used as a comparison there, we were already spending in England a third less than spending per head in Scotland and Wales. So this was spend per head in Scotland and Wales, and spend per head, this is not age-adjusted, just pure spend per head in England. And spending has been under pressure in Wales as well, rise a bit, and then came under a bit of pressure here. But actually, if anything, the gap has increased ever so slightly. So we started out quite considerably behind and have maintained, if not extended, that picture. And that does point to the extent to which this is a policy choice. So 2 other countries within the UK have chosen to invest significantly more in adult social care than England. The other thing that it's really important, I think, to think about here, what I've done here is to split out the spending where we can identify it by age on working age adults and older people. And the first thing to say is around 55% of the spending that we can identify by age is on working age adults. And it's incredibly important in all the debate about social care that we do make sure that the system we put in place works for working age adults as much as it works for older people. And so we need to think about the position in terms of assets and income for working age adults, and if the state isn't there to provide those services, is it a question then that they're picking that up through their wealth and their income, or actually, as is the case obviously, for very many of working age adults, they don't have assets and income, so where do they go? The other thing I think we really need to think about, which goes beyond funding, is the very different nature of support that needs to be provided because of the different nature of the issues that are being addressed with the different client groups. So as you can see, the blue line is the spending on physical and sensory, that's people who've got hearing and sight problems particularly, as you can see, for older people, physical support and the need for physical support, coupled with support for memory and cognition, unsurprisingly now, are the biggest areas of support. But for younger adults, it is learning disability support which dominates. And these are quite different areas. So solution to social care needs to recognise and address not just the different wealth and income position of working age adults, but the very different nature of support that they need. And really important in this is not just access to care, and one of the consequences, obviously, that we know of the reduction in funding is issues around access to care. So Age Concern report for older people, now 1.4 million people who struggle with activities of daily living, not getting any help. Some of those may be things that actually informal care, voluntary support can help with, but they also say that there are 300,000 people within that who are struggling with 3 or more activities of daily living. So they're likely to be people who need quite intensive help, and so there are real questions about whether that can realistically be met without some formal support. But the other thing which is really important is quality of care. And real concerns, I think, emerging about the sustainability of the sector and at the rates at which we're paying for publicly funded care, whether that can deliver a high quality service. And critical within this is what is happening with the workforce. But I think it is worth looking at, we've looked here at, sorry, it's a busy slide, but it's I think quite an important one, what's happened in residential care and the costs of a unit of care in residential care and nursing care. And as ever with social care, there are big problems with the data. So not everything is strictly comparable. But what you see, I think, is in those early, and the red line is GDP. And what you see is in the early years when funding was first cut, actually unit costs were rising at below GDP. So I think what commissioners were doing, what local authorities were doing, was trying to bear down on costs. And there may have been some scope to do that in the short term. But what you start to see after 2015-16 is that unit costs now are rising at a faster rate than GDP. And this almost certainly reflecting the work of Competition and Markets Authority, raising concerns that the average cost being paid by local authorities now is below the cost needed to cover high quality care, and issues with the workforce. Yeah, so a significant proportion of the workforce, obviously, on minimum wage. That has been rising, but big issues with recruitment and retention difficulties in the sector, which are leading, obviously, to problems not just in the ability to staff, but also in the quality of staff with very high turnover rates. So overall, I think our estimates of where that leaves us before we come to any of the issues about free personal care, caps on care, balance between individual and the state, if we want to create a sustainable system which is to provide some level of reasonable access to care for both working age adults and older people, and some decent quality of care, what sort of sums of money are we talking about? Well, one way to start to think about this is if we had kept pace. So if you think of how much England was spending per head of population in 1011, if funding had kept pace with that and met the growing need for care based on demographic changes, how much more would we be spending today than, and that is, so today it's about here, it's about 6 billion. If we come to when we're expecting the next Parliament to end, if all goes to plan, and this election delivers a stable Parliament, then the gap would grow to around £12 billion. Yeah? So in a way, that is that would take us back to the sort of provision that we had per person, and both in terms of range of services, but also funding to providers in 1011. If we accept that, that's not where we start from, and we look at what the spending power of local authorities looks like being based on things like the announcements government made about the precept, yeah, and we look just at what's going to happen to demographic pressures, to the ageing and growing of the population, we'd have to spend 2.4 billion to stand still. But that presupposes that we can carry on not essentially funding some of these workforce pressures, and we really don't think that is sustainable. So if you try to meet that growing need and fund the workforce, then you're talking about 4.1 billion. So in essence, not for us, not making the system any worse than it is today, would cost around 4.1 billion, yeah? And you need somewhere between 4.1 billion and 12.2 billion to start to improve quality and access to care back to the sort of levels that we were seeing in 1011. So that's the context before you get to funding. And I'll hand over now to Andrew, who's going to talk about that.
Thanks, Anita. It's great to be here. So what Anita's been talking about, which is absolutely the fundamentals of what we have to do first, is we've got to make sure that the means-tested system that we have in the UK at the moment is properly funded. A reasonable litmus test of what kind of society you are would be how well you look after people who can't look after themselves. And the current structure of social care is meant to do that in the UK. It's not meant to do it for everybody. It's only even trying to do it for those who don't have income or assets of their own that they could spend. So it's really just looking after the most needy, and we haven't been spending enough money on that. And we see across the UK pressures, and we see in England extreme pressures, some local authorities having enormous trouble doing that. So the first base is make sure that you're providing enough funding to look after those who have no possibility of looking after themselves. We've seen over the last few years some additional funds allocated each year. We're seeing most of the parties in this election campaign guaranteeing that they'll put more money in to try and tackle this problem. So that is that's first base, and the report that we worked on 8, 9, 10 years ago made that very clear. Before you even start thinking about anything for the population as a whole, you've got to make sure that the means-tested foundation of the system is adequately funded. Well, once you've done that, why would you do anything else? That's the kind of next question. That's the wider funding of social care question. If you're looking after those who don't have enough resources of their own to manage, why would you do anything for the rest of the population? Why would you be worried about this selling houses thing on the middle classes? And the answer to that is it's about variation and uncertainty. And that's true in many policy areas, that variation, individual difference, and uncertainty turn out to be the critical issue. So many of you will have heard me talking about a slide that looks like this before. So this, I think, is the critical bit of information for thinking about why we might need to do something about social care. So the idea here is we've lined people up, probably aged about 65, in order of how much social care they're going to need before they die. So the lucky people are those at the far left. They're the people who are walking down a shopping street, hale and hearty at the age of 95, die, no need for social care at all. And then the people at this side are the people who are, in some senses, less fortunate, although many of them may live long and fruitful lives, but to lead those long and fruitful lives because of chronic arthritis or sensory deprivation or cognitive decline need a great deal of support. And this is a schematic version of this of the data, partly because the data hasn't been updated since our report in 2010-11, which is a story all of its own. But the point it's making is that there is enormous variability. It's not the case that everybody faces the same social care outlook. Some of us, probably best part of a quarter of us, will need almost no social care at all. Some of us will need an enormous amount. The challenge is we don't know who's who. And in some cases, some people are going to face very large costs indeed. It's perfectly plausible to imagine that an individual could face many hundreds of thousands of pounds of costs, that a couple could face costs that in aggregate exceed £1 million. And this variability means that one thing we can be absolutely clear about is that the correct response to this is not saving. It is not sensible to say to everybody they should save enough just in case they turn out to be the extreme case. That's not how we respond to these kinds of challenges. This is a risk pooling problem. It's absolutely clear that the challenge here, given that some people will face very low costs, the median person will face non-negligible costs, but much lower than those at the end. The challenge is risk pooling. We need to pool this risk. That's what's going to make everybody feel better. So surely it's just a classic insurance problem, and the insurance industry should be dealing with this. The insurance industry deals with the possibility that our houses will burn down. The insurance industry deals with the fact that we might have a car crash. Why doesn't the insurance industry get itself together and sort this out? Well, I'll come to why in a moment. What's the consequence of the situation as we face it at the moment? Well, the consequence is fear and anxiety. Because although you might be one of these people, you also might be one of these people, and you don't know which of those people you're going to be in. At the moment, the system from the state doesn't provide any opportunity for you to deal with that, nor does the private insurance market. One of the best analogies I can think of for this is needing social care is like being in a shop with no prices. And there are people, some of us know, I'm not sure I know anybody who would be really comfortable in a shop with no prices. There are a few very, very rich people who feel comfortable in shops with no prices. Why is social care like that? Well, because although when you start to need social care, or your parent or grandparent or partner needs social care, you know how much you're going to be charged each week or month. You've no idea how many weeks or months it's going to go on for. So actually you are completely paralysed. And it's important to note that not only are consumers paralysed, but so are providers. Because selling something when you can't tell people what the price is means that almost everybody will want to buy the cheapest thing that's possibly available. So this market really doesn't work very well. Why doesn't the private sector provide insurance? Well, because while any of us can go out, and if we wanted to, we can buy insurance for our car next year, or we could buy health insurance for next year. If you go to your car insurer and say, I'd really like you to provide me with a fixed premium now for insurance for whatever vehicle I'm driving in 30 years' time, they'd laugh. 30 years' time we'll have probably autonomous vehicles. Who knows what the liability possibilities could be. If you went to a health insurer and said, I'd like to pay now for health insurance in 25 years' time, they would also laugh. The reason they'd laugh is we know roughly the shape of this line now. We've got no idea what shape it will be in 20 years' time. It could easily not be here, but be here. And if it's here and you've written some private insurance, then you go bankrupt. There were some policies like this available in the UK a couple of decades ago. The people who got them are very happy. The people who provided them have gone bust, almost without exception. Nowhere in the world can you buy insurance for the catastrophic risk here, and that's the real challenge. So what should we do? Well, one option would be to say, let's have the state take the whole lot. And that's precisely what we do in the case of the NHS. So the healthcare looks roughly like this, schematically too. In the case of the NHS, the state takes the whole risk. That's precisely what the NHS is doing. It's pooling risk of ill health across the population as a whole. We could do that here, except there's very little enthusiasm politically for doing it. The costs would be substantial, although not impossible to cope with. There are two challenges to it. The first is that actually most people, when you ask them what they feel about this, they say, well, I don't think it's unreasonable that those who aren't at the bottom of the income and wealth distribution should make some contribution to their social care costs. It's not unreasonable to make some contribution. People can prepare somewhat. So there is, I think, a willingness to make some contribution. The second is that if the state takes the whole lot, you have to trust the state that it will take the whole lot in perpetuity. And what we've seen in a number of countries which have said they'll do that is when public finance pressures have come along, it's become difficult to sustain. And then people at this very awkward tail end are often the people who suffer most. So if the state's not going to take the whole lot, and while it could, that doesn't seem likely at the moment, the question then becomes, well, if it's going to take a part, which part should it take? One suggestion that's come up over the last 20 years is that the state should take some of all of it. So this will be one way of representing a suggestion like free personal care. Free personal care, which sounds very generous, is actually a promise to pay a certain part of your social care needs. In Scotland, we think probably it amounts to about 25% of the costs for residential care, and do that for everybody. That would mean the state taking this blue slice. That's clearly for people, that's better than where we are now. My healthcare analogy would be a bit like saying if we had a purely means-tested healthcare system at the moment, saying we'd extend it by moving to providing free GP services for everybody. Well, that's clearly better than not having them, but it still leaves this problem here, in the same way that if we provided free GP services for everybody, you still had to pay for your hospital care. If it turned out that you had a really serious acute illness, you'd be stuffed. Free personal care, it gives money to everybody down here, and it helps the person who's really hit hard a bit, but it still leaves this, which is still catastrophic. So we could do this, and something like this is in some of the parties' manifestos, but I think that the analytically better thing to do is something like this. So say, well, if the state's got any money to spend, we start with the people who face the most terrifying prospect. So what we do is we guarantee that if you're in real trouble, the state pulls you out of it. So one way of characterizing a structure like this is, so we leave the individual paying up to this amount, the state takes this. This is social insurance, but with an excess. Now, if you were a party that wanted to spend a lot of money, the natural thing to do here would be to bring the level of this excess down. Indeed, if you bring the level of the excess down to zero, then you've got universal free care, which is the NHS solution. If you're a party that believes it's got less money to spend and believes more in people looking after themselves, you might raise the cap. But critically, and I could go on about the economic analysis here, if you're going to insure less than the whole of a risk, the bit of the risk that you should insure is the catastrophe, because that's the bit that is most terrifying. We're in a funny position at the moment, which is that most of the political parties are actually in favour of this. They just haven't done it. So the Labour Party has, as part of its policy, putting a cap in place. The Liberal Democrats have, as part of their policy, putting a cap in place. And the Conservatives, although there was a certain amount of hokey-cokey in the 2017 manifesto and election campaign, by about 4 days after the manifesto, they were committed to having a cap. So everybody's in favour of this at a political level. There is consensus in England that this should be done. It just hasn't been. Let me say a little bit at this stage before finishing off about those of working age. It seems to me there is a reasonable argument for older people of saying, well, it's not unreasonable that they should make some contribution towards their care costs. Most of us are going to have some care costs. You've got a lifetime to prepare for it. What should we say as a society to people who are 18 and have already got an established care need? Is it reasonable to say to an 18-year-old who enters working age with an established care need that they should prepare for and pay for some of their care costs? Absolutely not. It seems to me blindingly bleeding obvious that in any system, the cap for people of working age should be 0. That is, for those of working age, if you enter working age with an already established care need, that's a need that should be pooled across the population as a whole. Is it difficult? Well, let's think about the amounts of money that would be involved. When we reported, we suggested an amount of between, setting the cap at a level between £25 and £50. We picked £35,000. In real terms, that would now be £46,000, which shows how long ago it was. We also suggested some reforms to the means tested system to make it better. The cost of that, reforming the means test to make it more sensible and putting a cap at £46,000 will be £2.6 billion a year in 2019-20. Total public spending is £800 billion a year. By 2023-24, it would have risen to £3.1 billion. That is not a tiny amount of money, but nor is it a large amount of money relative to the amounts of money that have been kicked around in the recent past. One of the other attractions of this model is that it does give flexibility. So we're going to need some political consensus about this. People with different political views can perfectly reasonably say they want to set the cap at different levels, which will have different costs, but actually the attraction is still you're taking away the catastrophic problem. We can choose to do this. The depressing thing about social care is that this is something that is critically important for running a decent society and for people's well-being. The amounts of money involved are not massive compared to the amounts of money that are talked about in most other public policy areas, and we still haven't done it. So my overwhelming plea to the politicians is to stop talking and start doing. We've had 20 years of depressing levels of inactivity. This is not the most difficult challenge in the world. Of course, we have to work out where we're going to find the money from, and it seems to me it's perfectly legitimate to expect some of that money to come from older people, but we should just get on with it. I'll pass on to Paul.
Or to coin a phrase, I think what Andrew was saying, just get it done. I think the problem with being head of the IFS is that Andrew gets up to say all these great things that we need to do, and I've been asked to get up and say the miserable stuff about how we actually do go about funding it, which is actually quite a difficult thing to do because there are almost an infinite number of ways in which you could find the 3 or 4 billion that Andrew was talking about, or even the 10 to 12 billion that Anita was talking about. We've got a great big tax system which raises £700-800 billion a year. There are plenty of tax systems in the world that raise a lot more than that as a fraction of national income. We're about average across the OECD, and in Western Europe we're significantly below average. So clearly we can raise more money. It's worth saying that in historic terms, tax revenues in the UK are relatively higher than they've been for a long time, though not by much, but they're going to have to go up over the next 20 or 30 years anyway, not just for social care, but also if we're going to meet the challenges in the health service. So there are a huge number of options open to us. Good place to start. Where do we get revenues at the moment? You can see on that chart there are 3 big revenue raisers: income tax, VAT and national insurance contributions, which between them raise nearly 2/3 of tax. Then you can see other indirect taxes, fuel duties and that kind of thing, corporation tax, council and business rates, and then some other bits and pieces. We've got lots of proposals for raising taxes. The Liberal Democrat manifesto yesterday had £37 billion worth of tax increases. That's quite a lot. None of that was for social care, and they were simply committed to a People's Assembly on social care, not to actually spending anything on social care. But just thinking about where they got their money from, they got about £8 billion from putting a penny on all rates of income tax. They got a fairly whopping £5 billion from air passenger duty, £6 billion or so from increasing corporation tax, the usual made-up number for tax avoidance and getting rid of some of getting rid of some of that. I'm not having to go to Liberal Democrats. All of the manifestos will have a made-up number for tax avoidance. They've just gone first. So plenty of options there. We're getting the Labour Party manifesto today. That will, if it looks like the 2017 manifesto, that will be looking for £50 billion of tax rises. Again, in 2017, none of that was for social care. Going by the way they've been going, maybe there'll be a bigger number this time. They were talking about huge amounts coming from, implausibly huge amounts coming from companies, some money coming from rich people. So there are lots and lots of ways of raising additional money for a bigger state if that's what we want to do, some more sensible than others. So what about looking at this particular issue? Are there some particular ways that we might think about raising money? Well, one answer is you could look at those big, broad tax bases: VAT, national insurance, and income tax. You put a penny on any of those, and you get £6-7 billion. So all you need to do is put a couple of pence on any one of those, and you've sorted the funding problem. You might not get elected, but you've sorted the funding problem. That's clearly one set of options. But in a sense, there are some things that are special, I think, about funding social care. One thing that we talk about far too little, actually, is at the moment it's funded through local government, and it's just worth reflecting on that briefly. At the moment, there are for the current government, two sets of policies which come into direct conflict. One is that there is a supposedly national set of standards for social care. The other is that local authorities are responsible for delivering it, and increasingly they're responsible for raising their own finance. From a world in which 8 or 9 years ago, local authorities were raising on average less than half of what they spend. They're now raising something like 80% of what they spend, and on average, and that's increasing over time. So two problems there. One is that the tax base that different local authorities have has no correlation whatever with the social care needs that they have. So actually, even if we get to a world in which local authorities can raise more money, it may be the wrong ones raising the money for what they need. So if, for example, if they get to retain more of their business rates, which is one of the current policies, it may be the wrong councils who get to retain those business rates. A second problem is this, which is that given the current public finance framework, if we keep local authority funding broadly as it is and increase council tax even by 4% a year, then the amount of local authority spending on adult social care will raise from 38% to 55%. It's already risen really quite substantially over the last 8 or 9 years. Local authorities have been a bit like the government. They have, the government has protected spending on health, local authorities have protected spending on social care. So despite what Anita said, that's much better than most local authority services, where many of them have been cut by 30, 40, or even 50% in terms of funding over this period. So if we carry on that basis, then everything else in the local authority sector gets squeezed. Squeezing all of the other things. Clearly, if council tax go up less quickly, then it's an even higher fraction. If it goes up more quickly, it's a somewhat lower fraction, but even so, you end up spending a lot. So one of the big issues that we've not talked about yet in terms of funding social care is how it happens. Does it happen through central government or local government? If it happens through local government, then we need quite a complex addition to the way in which we fund local government. The second way in which social care is special in terms of funding is that, particularly if we're looking at the sorts of reforms that Andrew was talking about, that money will go to people who are relatively better off, and in general, people who are older. So that's not the bit that would fix the current system. That would still go to those on means tested, who will be means tested. But if we want to move in the way that Andrew was talking about, by definition, it's those who are not currently covered by the means-tested system. And if you want to provide an insurance system of that kind, it's perfectly reasonable to do it in a way which on average affects the group who are going to benefit. And the group who are going to benefit are those who are relatively older and those who are relatively better off. Now, there are all sorts of ways in which we can think about changing the tax system in good ways, which would actually start to get some money from those groups. I will simply run through 3 or 4 examples of that, but a much easier example would be you could put a penny or two on income tax for people with higher earners, people with, who are currently in the 40% band, perhaps only if they're a little bit older. But some more interesting ones, you could put national insurance contributions at a low rate initially on occupational pensions in payment. Why do I say that? That sounds very mean. Well, because if you've got an occupational pension, then you won't have paid any national insurance contributions on that at any point. We have an incredibly generous system there. You could also cut the generosity of the tax-free lump sum. It seems to be very bizarre that we allow people to take £250,000 entirely tax-free out of money that's been saved in a pension out of pre-tax income. So that would pretty closely correlate with the group who we're trying to help through providing them with insurance, and between them could raise several hundred million, probably £1 billion plus pounds, depending on exactly what you did, and I think would be a good improvement to the tax system in any case. You could reform council tax, update it and make it proportional to the value of properties rather than, as it is at the moment, regressive in the value of properties, by which I mean the more expensive your property, the lower the fraction of it you pay in council tax. That would clearly, in general, hit people who are wealthier, in the sense who have got more expensive properties, and that tends to be people from the older generation. As I said, you might not get elected, but it's nevertheless a good idea. There's plenty you could do with inheritance. There's plenty you could do with inheritance tax. There are some extraordinary reliefs in it that give reliefs to particular kinds of assets. There are all sorts of other reforms that you could make to inheritance tax, changing the rate, changing the point at which it becomes payable. Now, you need a lawyer as well as an economist to help you with inheritance tax. I always think it's not the easiest thing to change and be sure that you can get some money, but one could get rid of the additional allowance for owner-occupied housing that the government brought in 2 or 3 years ago, for example. I'm pretty sure you could get £1 billion or 2 out of some fairly straightforward changes to inheritance tax. There's quite a lot you can do with capital gains tax. It's an extraordinarily bad tax at the moment. It provides very easy ways of avoiding lots of tax for some pretty well-off people running their own companies. The forgiveness of capital gains tax at death is a big benefit to a group of extremely wealthy people, and the fact that there is a separate £20,000 a year allowance for capital gains tax from the income tax system, again, gives you a pretty easy tax shelter. Now, you can choose any of these, do something fairly modest with all of them, and you easily get the kind of money that we're talking about from the kind of group that you might think ought to be paying for this. Now, one objection always raised to most of these, certainly if you're looking at NICs or National Insurance on Occupational Pensions, to changes in capital gains taxes, they all look a bit retrospective. It's not fair. Someone saved in their pension with the expectation of this tax, with this tax treatment. Someone got their capital gains with the expectation of the tax treatment we have at the moment. Well, that's true, but tough. I mean, that's how all taxes work. I worked with the expectation of facing a certain income tax rate or a certain VAT. If you change that, that's almost equally retrospective to doing some of these things. This is on a spectrum. This is not retrospective, and this is. That just requires a more intelligent debate. So lots of different ways in which you can fund it. No one likes raising tax, which is why I always get to talk about it. But if we want to do what Andrew and Anita want to do, then we can do it. Thank you.
Lots of numbers, lots of sense. So we've got plenty of time now for discussion. What I'm going to do is ask each of our panellists one question and hopefully have a brief answer to that while you're mulling over your choice question, and then I'll turn to you. We've also have questions coming from people who are watching on the live stream. Can I just first turn to Anita? I mean, if the sum total of human misery that has been caused through lack of reform and tackling this issue has not moved politicians, one thing that could move them is the state of the NHS, because the NHS is number one, give or take Brexit, it is number one on the list of public concerns, and everybody working in the NHS can see spillover effects. How big an issue is this, and has it been quantified? I just noticed that Scotland, in your figures, spends, was it £460 per head, compared to in England £320 per head for social care. Is there any evidence that pressures on, for example, A&E from demand from older, frail people, for example, are any less in Scotland?
So there is a bit of evidence, and colleagues at the IFS have provided some of it, or that in areas which have seen larger cuts in social care, there has been some knock-on impact on A&E attendances. But fundamentally, I think the evidence is clearer that we need to see social care in its own right and understand it for the important service it is for adults of working age and older people to living a life of dignity and independence. And most of what social care does isn't about avoiding a healthcare need, it's about supporting people to have a quality of life and meaning in that life. The work that we've done with RAND over the last couple of years, I think has really highlighted that one of the big issues here, which perhaps explains some of the political problem, is that when you speak to individual MPs, they all have cases at any one point in time which they're horrified about lack of care and the problems that individuals are experiencing as a result of that. But most people in the country don't understand how social care is funded. They assume it's the same as the NHS. And if you need social care, you just turn up to your GP and it will be provided in the same way. So what I think is one of the lessons from the 2017 campaign is that in order to actually mobilise public concern, because when we do all the deliberative work and explain to people how it operates, they are outraged. They are absolutely outraged. And get absolutely that in a decent society, we should do three things. Make sure that if people need care, they get it, that it's high quality care, and not leave people to pick up the tab of catastrophic cost. You know, there's a remarkable degree of consensus around that. But in order to actually win some of the political argument, you first need to overcome the problem that people need to understand that that is the problem. And for politicians, then, you need to take the hit where people say, but you've all presided over this system. You know, this is your fault. You know, this is what you've allowed to happen over decades. And that hit, which is in essence, I think, what Theresa May found that she was on the receiving end, is very difficult for any political party. So it takes, I guess, quite a lot of courage to accept that hit and reform. And most reform probably won't deliver all that people hope. So it's quite a hard proposition in that sense.
Thank you. Just turn to Paul for a minute. If government sort of came up with an extra 12 billion, which is on Anita's chart for social care, to take us back to 2010 levels, I was very struck by your figures on the local government share of spending that you put up. What would be a government objection to pooling that raising 12 billion, pooling it and distributing it according to need to local government on that scale? Is that a block? Do they not trust local government to do this? Do they not want to distribute it according to need? What might be a political block here?
Well, you can clearly do that.
Yeah.
My point really was only that at the moment, central government has two objectives. One is to have the same level of social care in every local authority, and the other at the moment is to give local authorities more incentives to raise more of their own money from particularly business rates, such that you will get a divergence in capacity to pay by local authority. It is also part of government policy to try to get the local authority sector as a whole to be self-financing. Clearly, if you're going to find that 12 billion from somewhere else, you move away from that position of self-financing. And if you're going to properly equalise across local authorities, then you're going to move away from a world in which individual authorities have these incentives to increase their business rates income. That's a fundamental issue about how we how we divide money across local authorities and what incentives we give them at a local area. You can either equalise across the piece and do everything you can to make sure that each local authority has the same capacity to provide the same set of services, or you can devolve more responsibility and incentives to local authorities such that those that are well run and successful and lucky do have more resources relative to those that are badly run and less successful and unlucky. Historically, we've always favoured the first, which is to equalise across and not give incentives. The current government wants to move a little bit away from that, and this is where you really get that conflict.
Thank you. And turning to Andrew, I mean, you've been at, I mean, this is probably the core question of the morning. You've been, there seems to be political consensus, doesn't there? You said on some form of cap. You've been really close to it all for a long time now. You stopped short of really spelling it out. What is the actual critical issue stopping them?
Yeah.
Can you just say a bit more about that?
So I wish I really thought I knew. I think there are some candidates. So one candidate is what you've just been talking about, the fact that it's a local authority responsibility, not a central government responsibility. I think that's allowed politicians in government to push some of the responsibility off themselves onto local government. I think that's one of the reasons why there's some enthusiasm for keeping social care as a local government issue. Social care is a local government issue as a result of historical accident in 1948. In 1948, we took almost everything away from local authorities. We didn't take social care away from local authorities because at that stage it was very small. So I think one reason is that it's a local authority responsibility, not a central government responsibility. A second is just the money thing. That I think that Treasury ministers, Treasury civil servants traditionally don't like expanding the envelope of government. And what we've got here is an area of government where the community as a whole has not taken on the sharing responsibility for a problem. I think there are strong arguments for it, perceived by most politicians, but not much loved by the Treasury. It's just not something that the Treasury is in any circumstance keen on doing something new. And then the third thing that I think we should be very honest about is that this is not this isn't an area that it's nice to think about. So individuals, we don't ourselves like thinking about the fact that there is a possibility, not a high probability, there's a possibility that each of us in this room, so I don't know, there's maybe 60 or 70 people in this room, 1 in 10 of us, so 6 or 7 of us, are going to have a pretty difficult later life, which to be fruitful and enjoyable will rely on a very substantial amount of care. And some of that care will be to do with things that we don't like thinking about, like continence. So we don't like thinking about the fact that we may become incontinent and need help going to the loo. We don't like thinking about the fact that we may need somebody to boil a kettle for us to have a cup of coffee. But those things can be done, and you can still have a very high quality of life. Thinking about those things is not like thinking about premature babies. Okay, so we find it relatively comfortable to think about premature babies. Politicians find it comfortable to talk about the impact of their policies on premature babies and their parents. We don't much like talking about the funding of helping people going to the loo.
Thank you. Right, that's a good place to start. So we now have thank you. We have Norman Warner here. Thank you. Norman, say a bit about your background as well for the younger people here.
I'm Norman Warner. I was a member of Andrew's commission, and I agree with every word that he has said. And I was also a health minister for 4 years, but much more importantly, I've been wrestling with this issue for 35 years, because I was a director of social services for 6 years, between the middle of the 80s and the early 90s. And it's worth just going back to that time for a moment. I got by in that period because of money that was coming to me from central government. I got a lot of money for running down psychiatric hospitals. I got a lot of money when the Thatcher government got fed up with funding the nursing home sector through social security budgets. I got another lot of money for that. And I got a lot of money out of the housing association because I got rid of all my old people's homes into a housing association. Now, essentially, what that did in a rather devious way was get me a lot of central government money. And so I wasn't actually coping with this out of council tax. And I think the issue that has to be really addressed is, are you going to be able to solve this problem with a council tax funded system? The answer is almost certainly no. And that argument has not really been got up with the public or with the politicians. We've not frightened the wits out of them about that. And it's worth remembering that actually when the Thatcher government, the Conservatives, grappled with this problem of funding a nursing home sector and residential care sector through social security, there was a huge debate in government about whether that social security money should actually go to the NHS or to local government. Mrs. Thatcher wanted to give it to the NHS. She was persuaded by Ken Clarke and Roy Griffiths to give it to local government. So there have been these debates historically about whether or not you can fund this system out of local government and through council tax. And I don't think we've had that public debate. And I think we need to have it. I don't know what the group thinks.
Thank you. Let's take a couple more questions. So we have a lady there and a lady here. And then Tasha.
Hello. My name's Nikki Freeling and I work for North London Partners, which is an STP, and I'm on the adult social care aspect of that. And what I'm still trying to get my head around is the relationship between adult social care and the NHS and the funding relationship between the two. Because the place that I am in the system is a constant kind of backwards and forwards about how social care is costing the NHS money, NHS is causing social care problems, it's meant to be an integrated system, but actually discharge causes pressure on social care, admission causes pressure on the NHS. So hearing a discussion that doesn't tackle what could be saved across the integrated system, for me, still begs quite a big question. And I worry that NHS colleagues still don't really feel adult social care is quite their problem, even though they're heavily reliant on people leaving hospital into social care. And I hear from social care providers all the time that they're delivering nursing care while being designated as non-nursing. And I wanted to know if any of the financial solutions could somehow at least enter that field of debate, because I don't think we can keep these two beasts as completely separate beasts and come up with a solution.
Thank you very much. And then the lady here.
I'm Margaret Blake from Ipsos Mori. I'm thinking about the cap, so it's a question about the cap and the extent to which the lack of implementation is to do with the practical difficulties of putting the cap into practice, because the cap would only be on eligible care needs funded at a certain rate, and therefore in order to judge whether somebody's spent money up to the cap, you have to know what they've spent and how that can be measured, and what are the proposed solutions to the practical difficulties, assuming the money could be put in place.
Thank you very much. So we've got three separate questions. Perhaps the first one, Norman Warner's question on the local government issue. Can local government raise their money? Answer, I think, was no. Do you agree, Paul? And then this, I think isn't there an issue here about the trust of central government that local government can handle that amount of money? Particularly when you think there is, what is the check on local government at the moment other than expenditure, budgetary constraint? There's no audit commission any longer to look at performance, for example. The health service, on the other hand, has quite a lot of constraints, regulators and so on, but not local government. So, Paul, can you tackle that one?
I mean, you're quite right, obviously, Norman, that, I mean, you can't just do this through council tax. I mean, where there are big council tax bases is not necessarily the place where the money is needed. As I said, you could get more money nationally out of council tax if you could reform it such that people in more expensive houses were paying more, and then you could put that into a pool and redistribute it. But the fundamental answer to this must be from older and better off people as a whole paying more tax into a central pot, which is then distributed where it's needed. But I agree, Jennifer. I think there is a there is a problem here. We don't want to get into the sort of whole politics of local government at this point, but there's a long-term problem, I think, here in this country in two respects. One is about the organisation of local government, which is sort of makes very little sense with districts and councils and unitary authorities and metropolitan boroughs and so on, which to make a decent health and social care economy would need to often, some of them would need to work together, some of them are the right size, but we're not talking about reorganisation of local government at this moment. And the second problem is about the scale and scope of local government. In one, rather like the central state is increasingly becoming a sort of health service with a state attached, local government is increasingly becoming social care service with local government attached, and whether that makes sense in that context, I think, is itself quite a big question.
I suppose could a third be the control of public expenditure at local government level, if a larger proportion is centrally government distributed?
It's always been quite a large fraction from central government to local government. In a sense, local government have really taken a big hit over the last 10 years. I mean, their budgets overall are down something like 15 or 20%. Some parts of local government spending, as I said, have been cut really dramatically. So in one sense, local government has shown itself remarkably capable of being of taking a budget and delivering to that budget and slashing services in order to do it. Now, whether they've all done that in the most effective and efficient and sensible way, I don't know. But they have shown themselves able to do that. I mean, whether they showed themselves able to sensibly make use of the resources, really very generous resources they had before 2010, I think is perhaps more open to question.
Thank you. And Anita, there's a question about the spillover effects on the NHS and quantifying those from lack of social care.
And I think there's a real question here about the integration of services. And one of the challenges here is, I mean, it's very easy to think about this particularly through the older people's lens and the clear relationship with healthcare, both with NHS continuing care, which is a very sharp boundary, but also obviously with community health services, GP and acute need. And social care will argue, well, actually, health service has been discharging people from hospital much earlier, sending people home with much higher needs that we then have to pick up. Health service will often say, well, we've got hospitals full of people because, social care isn't looking after. So, and clearly, for individuals, in a lot of cases, the failure to coordinate that care well across the two leads to outcomes which are suboptimal. The evidence that you can save a lot of money, is really thin on the ground. And people have been looking at it, it's really thin on the ground. But I think when you start to think about, in particular if you start to think about younger adults and think about this, the problem we've got is that we've got integration points elsewhere. So Norman talked about housing. And housing is really important, isn't it? Because one of the things that may well address some of the in a more preventative way, some of the issues that older people face is more appropriate housing design. The other thing for younger people then is the relationship with work. For example, and the NHS isn't very skilled at how to support people in work. So I think given what we're trying to achieve with social care, which is to look after people in the main, often for a very long time, to fulfill worthwhile and independent lives that have meaning to them, as defined by them, we are going to have to join up a lot of different services starting with the individual. And I increasingly think that doing that via budgetary integration and a search for savings is not the right way to come at it. And we ought to spend a lot more time thinking about the workforce issues and the service design issues in the integration. And wherever we put social care, we will have interface issues, and we need to just get much better at thinking about how we manage interfaces rather than looking for some organisational neatness, because I don't see an organisational boundary that fixes all of those issues.
Great, thank you. And Andrew, the technical issues about how to calculate whether someone's near the cap or not.
Yeah. So this is a very good question. I'll talk a bit more in a moment about what the alternatives are. But it's important to stress that if you're running a system like the one I described, you haven't got to monitor what anybody is spending. The process is 20 years from now, I pitch up at my GP and I say, I'm really struggling to get out of bed. I'm sent off for an assessment, as we are, and the assessor says, okay, yeah, we need to put you in a residential care home because you can't look after that will cost us £700 a week. You have a university pension, so you're not entitled to care now. Come back to us in 50 weeks' time. If the cap is set at 35,000, so what you're measuring is not what people spend, but their accumulated need, and the assessment processes that we have already automatically calculate that. We calculate the severity of people's need. We know what that would cost the local authority to provide. That's the speed at which you move towards the cap. And the local authorities, although they weren't completely ready in April 2015, or just after the 2015 election, they were on their way to being ready. They were expecting to implement in April 2016. That was what the Care Act said, so I think that had been done. Of course, we did think about other ways of setting that cap. Should you set a cap in after 2 years? Well, the trouble with that is if you set a cap after 2 years, somebody who has very severe need could accumulate a great deal of expense by then, whereas somebody who just needed a bit of domiciliary care wouldn't have done so. That didn't seem so fair. Could you say, well, actually, it's just for people who need residential care, and after a year's residential care need, but then you'd have a massive incentive for everybody to say they need residential care, not domiciliary care. So in the end, I think this is the most efficient way of doing it. But if I'm completely open to other ways, but having thought about it a great deal through the Commission and then through the pre-legislative scrutiny and the legislative scrutiny, nobody came up with a better idea than this. And you haven't got to check what anybody's spending.
That's great, thank you very much. So we have some other questions, I know. We've got 3 more. We have Natasha Curry to start off with. Just to say, to make her blush, Natasha authored an excellent report by the Nuffield Trust, which was looking at how Germany does this.
Thank you for that introduction. Yeah, so I did just want to touch on some of the international learning that we've brought together, because obviously we're not alone in the challenges that we face, but we seem to be fairly alone in having failed to address them. And so most recently I've been looking at the German system, which is not perfect, but they did succeed in bringing about fundamental reform. And it struck me when I was looking at that system that there were 2 main factors that made reform possible. The first one was a groundswell of public discontent and public pressure for change, and the second one was genuine cross-party political cooperation and working together for change. And I just wondered, and obviously in Germany they have a history of coalition governments, and I just wondered to what extent you think that the failure to achieve reform here is due to our political system, or to what extent is it the fact that I think we start the debate in the wrong place, and we talk about how much will it cost before setting out what is it that we want the system to achieve, and therefore a vision that we can then maybe sell to people more effectively.
Thank you very much. I'm reminded just from what you said, I was at a dinner on how to fix social care about 7 years ago, and Liz Kendall was there. I think she was the Minister of the Social Care at the time. And one of the things she said is that her MP's post bag was fuller about letters worrying about cutting down of forests than it was in social care. It just was practically nothing on there. So we have 2 more questions. Sorry, this gentleman here is next, and then the lady here.
My name is Telly Amaludin. I teach in London Met, Health and Social Care. I'm also director of the New Energies Alliance. There's a number of points for me has come up, which really follow on from Natasha's comment about the forgetfulness I felt in this room and society in general about the nature of politics here, whereas you've got one lot that want to reduce the role of the state and the role of local government. So the good old days of Norm's stewardship as director compared to the expectations and constraints on local government. It's totally different. So your ability to be innovative and respond to the problem you're facing, whereas now things are so much more atomized. But yet, Paul and Andrew's contribution said that there is a solution to the problem. Therefore, the political will is not there. But the point I also want to raise is that we're not addressing health inequalities, how health inequalities will contribute to life expectancy and that the time you have in care, depending on your ability, due to health inequalities, the social determinant of health, that's not part of the debate. For example, I was canvassing on a Sunday in this borough. Right. In an estate, whereas on one side of the estate, you're likely to live 17 years plus longer than this side of the estate. And you could imagine, if you could compare the social care needs of those on that Belgrade side of the estate, of the borough, and the long-term care needs, because the people on this estate are likely to, in terms of time they're likely to be in ill health, is going to be far longer than the other side of the estate. That's not part of the debate, but on the other hand, you alluded to it about those who are fundamentally need the care, need to be cared of, but we have to couch it in terms of health inequalities and the length of time.
Thank you.
The last point, I teach the workforce, those who are likely to be already in the workforce, are likely to be workforce in health and social care. Zero contract hours, even their health is poor, and yet you talk about access. I haven't even mentioned the needs of the BNE communities, and then in terms of the quality of care. If the quality of care is related to your workforce, how your workforce is being recruited, being taken care of, and yet also your workforce will have their own health issues, what does that say about the nature of the political system in this society?
Thank you. And last question for the moment.
Hi, I'm Jill Manthorpe and I'm from King's College London and also trustee of a large not-for-profit care provider. I wanted just to mention some things that our last speaker spoke about, which is about workforce. Both Andrew and Anita have mentioned workforce issues, which I think is a good term to use, but just how would any of the proposed changes and perhaps spend increases impact upon the workforce positively, both now and in the future?
Thank you very much. So 3 questions. So the first is a very broad question, which is are we really talking just about a more wider generic political problem that we have in making big and long-term decisions in this country? Hollow laughter, given there are plenty of examples of this around at the moment. Andrew, can I just focus that on you for the first instance?
Yeah, so there's a genuine puzzle about why we've done so poorly at this, and one of the things I'd contrast it with is pensions, state pension and provision. So in pensions we managed to get some political movement, not in unambiguously good direction. We got some political movement. I do think this is partly because it goes back to the central local government issue, that I think somehow we haven't managed to make central government feel this is their responsibility, and given some of the problems that Anita described, well, why, they'd like not to. I do think there is an opportunity now, because I think there is a growing awareness of the issue. I saw, it might even be in some Health Foundation work, a chart showing mentions in Parliament of social care, which has really dramatically increased over the last 2 or 3 years. I still don't think it's figuring as highly in MPs' postbags as one would expect, but even there, it appears to be much more present in MPs' postbags. So I think this is we need, if we're to get change, we need a groundswell of feeling that something has to be done. The current Prime Minister has made it difficult not to do something. I mean, he's pulled back somewhat by saying political consensus is needed, but the day he became Prime Minister, he stood in Downing Street and said, we're going to fix this. And of course, we've had that kind of statement made before. I think it's just incumbent on all of us to try to keep that pressure up.
Yeah, and the fix is linked to we don't want people to sell their houses, which is not quite the population that this gentleman here was really flagging up, people who don't have assets of that sort. And it's a sort of a blind spot then, isn't it? That and then links, of course, to treatment of the most lower paid workers.
Yeah,
Anita.
and I think it's really important to continue to emphasise that whilst addressing the fundamental failure in the balance of funding between the individual and the state is critical, we actually need to provide a high quality and sustainable service for people who cannot pay for this themselves. And that population will grow. Yeah? It will grow with the younger adults, and because of some of the trends that we're seeing in healthy life expectancy not keeping pace with life expectancy, particularly at the lower end of the income distribution, that will be exacerbated. And frankly, one of the ways that we've tried to manage social care is to bear down really inappropriately on the pay and terms and conditions of those who provide care. And so, and the statistics are absolutely shocking. 1 in 4 on a 0 hours contract, pay rates in social care, despite the minimum wage, less than kitchen portering, less than retail now. If you work as a care worker in the UK for 5 years, the premium in your hourly pay over someone who's just started is 15 pence an hour. 15 pence an hour. So the idea in this system, then that we can sustain quality, and if you think about the needs that now people in social care are providing, the importance as you describe of what this care is, and the dignity and the trust that you're bringing with someone who is most personal contact that you can have. And we've got turnover rates rising for the frontline care workers up at 40%. So these issues, if they are not central to a solution, to my mind, are not a fix. And I think that does link very much to Natasha's point. I mean, if you sell insurance on a car, but you say to people, we're going to provide insurance, but for most of the accidents that you're going to happen, it won't cover you. And when you do, you won't get a working car like the one you had before. If you're lucky, we'll give you a sort of clapped old banger. That's not a sellable proposition. So it has got to be a holistic offer, which gives people reassurance that when they need care, they will get care, and that care will be high quality, and that high quality doesn't come at the expense of the workforce. They must be the essential ingredients of a fix.
And can I just make 2 very quick points on the workforce? I agree entirely with Anita. I make 2 points on the workforce. The first is, despite all of this, and I think it's something we should say loudly and often, most of the workforce in social care are extraordinary people. I mean, extraordinary people showing remarkable respect for and affection for the people for whom they're caring, and that's something that we should celebrate. And we have 1.5 million people working, and they're extraordinary people doing an astonishing job. The second thing, it goes to a point over here, can doing something about this do something about their terms and conditions? Well, yes, because in particular, the wider funding point, as I said at the moment, buying social care feels like being in a shop with no prices. If you're in a shop with no prices, you want the cheapest thing that's available. If we can move to a system where people, the population as a whole, the wider population, has some security and flexibility, then there will be scope for innovation and investment in new forms of provision. And one of the things it should do is gradually lift the wages that are being paid to people in this sector because some of the consumers will actually be able to demand more expensive services, and that should lift the standards of provision for employees across the sector as a whole. And that's critical, because to carry on as we are now, where almost everybody is wanting to buy the cheapest thing that's possibly available, just grinds down the terms and conditions of the fabulous people who are providing this care.
Thank you. So we've got less than 5 minutes to go, and so what I think we ought to have is some final reflections from our panellists. Just to preface while they're thinking about that is, there seems to be two obviously linked issues here. One is the political issues of the principles of what we want to achieve here that need to be hammered out between politicians and the public, probably, don't they? But the second thing, which is obviously linked, is then technical issues about how to raise the money and how to handle that, which could conceivably be solved at a later date if the principles could be hammered out first. So I think what I'd like to ask each panellist now is, you are facing a camera over there. At the other end of that camera are the leaders of all three political parties. What do you now want to ask for to effect some change at last? Perhaps if I start off with Anita.
So I think what we need to do now is to recognise actually that whilst social care may have been seen as really difficult, actually there's a remarkable amount of agreement, both when you do detailed work with the public, as we did with RAND, and actually with the experts about what needs to happen. Yeah? We need to have a properly funded system that establishes high quality provision for people who cannot pay. And then we need to more effectively share responsibility between the individual and the state for those who have some income and assets. And a cap makes sense there. And if you wanted to share a bit more of the responsibility along the distribution by adding in some free personal care type provisions, that's perfectly appropriate to do. Actually, now we know what we need to do. And there is a remarkable degree of agreement. So it is up to them. And it will be an outrageous failure, actually, if the political class don't step up to the plate now and address this issue, because it is the most vulnerable in society who are often hidden, who are bearing the cost. And that is what politics is there to do. It is to fix fundamental problems in society.
Great stuff. Thank you. Andrew?
I think I agree completely with what Anita says. And again, let's go back to, this isn't just about older people. This is about working age adults as well. And the working age adults about whom it is are in some senses even less good newspaper headline and photograph copy than the elderly people. And that's pretty disgraceful too. So I think one of the reasons, and I think it may be the most powerful reason why this hasn't got done, is that the people who end up needing this kind of care are not in the kind of situations that we like talking about, that politicians find attractive to talk about, and that's a kind of political immaturity that I think we need to get over. The amounts of money that we're talking about here are very small relative to the amounts of funds that have been put entirely appropriately into the NHS or into the education system or into social security provision for old age. And the fact that we haven't had the courage to look at this as a society doesn't really reflect very well on us.
Thank you. Last word to Paul.
It's hard to add anything to those two comments. But I think, in terms of looking at the party leaders in the eye, I think it is, look, if you came into politics for anything, surely you came into politics for solving some of these huge problems that only the state can solve and which are causing enormous misery at the moment. Frankly, you've come up with a set of manifestos which have got a whole pile of nonsense in them at the moment. You seem to think there's piles of money for everything else. Why the earth isn't this right at the top of your priority list, other than all of these broadly ideological driven things which probably aren't going to help anyone very much? I probably wouldn't put it quite like that, but but that is the fundamental point here. This is the core role of the state. This is currently causing untold misery among people who can't do anything about it or help themselves. that surely, if there's anything in politics you're there for, it's for that.
Thank you so much. That is a great place to finish. Thank you very much for your attention and for all of your questions. And we look forward not just to the manifesto froth and election froth, but the proof of the pudding will be after the election, won't it, to see what action is now then galvanised when the heat of the cameras is away from the campaign trail. Thank you so much. To be continued. But hopefully not too long. Well done. Thank you so much.